My name is Josh. My experience before this with implants was lots of restoration. I've never placed an implant before today. Dental school had pretty minimal implant experience. Well, first of all, I've never done an implant course, like a comprehensive implant course. So this was a pretty new experience for me. Other things that I've done, CE, were not hands-on, or they're focused more on, just the restorative part, but this integrated the implant surgery with the restorative aspects much better, I think, than other courses I've seen. So I think I've placed 19 implants so far, and then I've got another afternoon to go, and so I'm expecting to place upwards of 23 or 4, I think, by the time I get done with this last case. Yesterday, actually this morning, I liked the case this morning a lot because it tied together a lot that I've been learning the last few days, and I really felt like I was able to get on my own a little bit more. And I could always ask the instructors to pop in and check an angulation or something like that, but it was my case, and I could take it from start to finish. And I did the upper and lower arch for a overdenture on both, and did full mouth extractions, and placed the implants with the restorative endpoint in mind. So that's what it's all about. I was mainly here for the surgery part. What was surprising to me was the amount of time and dedication that they took to explaining the background with the restorative foundation. So the endpoint is not the implants. The endpoint is the restorations and improving the quality of life. So just knowing why we're doing the implants and how that changes the different ways that you would place the implants. The restorative topics was much more in-depth than I was actually anticipating, and even though that's not necessarily what I was looking for, it was awesome to get a really solid background on some pretty extensive restorative concepts. I feel like I have the tools to immediately start placing implants after the course. I'm excited to get back home and get some cases going. I feel like I've seen a lot of challenges and how to overcome different obstacles. One really kind of surprising thing about the course was you're not just placing easy slam dunk implants where there's a ton of bone, and you're doing a lot of compromise situations where you don't have all the bone you want to work with, or you have other limitations or complications arise, and you're seeing those. And so I feel like I've got a good handle on not just the easy cases, but some harder cases, or if some complications come up on those easier cases, I know how to handle them. So I definitely feel like I'm ready to go after this. The atmosphere at the Institute has been awesome. It's been really fun, really high energy. These doctors they just want to go. They're not slowing you down at all. You really feel like you've kind of been cut loose with very skilled guidance. So it's just a lot of fun to work. It's not like dental school where you're kind of held back a little bit and you're constantly having to check and sit there and wait. I mean, they're there for your learning, for your education, and these guys are really dedicated to the educational aspect of it, and it's been awesome. It's been an awesome atmosphere, really fun, and very focused too. I mean, we're here to learn and we're here to do. So I would absolutely recommend the course to any of my colleagues, especially if you're really looking for real hands-on, real life experience. This is the best I think you're gonna get. I think a lot of other CE courses are very heavy on the didactic and the book work, and I've got those books. I can read through those at home, but there's nothing like the muscle memory of placing a lot of implants, and just these guys are awesome. They're just really dedicated to you professionally and personally being able to go back and help your patients. So yeah, I'd do it again. I'm glad I did it.